Thank you for visiting our website. We hope that you'll get some good information here. We hope that some of your concerns can be relieved by perusing the website, learning what we have to offer. I founded the Hernia Institute of Louisiana back in 1998 out of a desire to ensure that we could bring world-class hernia surgery to the Gulf South region. Before that, we really did not have any centers of excellence for hernia surgery in this area. Through our collaboration with other hernia experts around the world and educational opportunities that we've presented here at the Hernia Institute, we're working to strive to make sure that we can bring the world's best hernia surgery to this area. So as we've learned more about hernias, why people get hernias, the recurrences, different lifestyle issues that may contribute to their problems, activities that they may do, even genetics play a role in why hernias are worse in some patients than in others, and why they're more common in some patients than in others. So we apply this new technology, the new techniques that we have, to individual patients as the patients present. No two hernias are alike. They're much like snowflakes. So we have to know that each individual patient has its own issues, and we try to tailor that to give them the world-class results that they deserve. Hernia surgery over the years has really matured in terms of what patients can expect in their post-operative recovery, how quickly they can get back to work. It's no longer sitting on the sofa for 6 weeks. Patients come in, the most common operation that we do is an inguinal hernia repair or groin reconstruction. Most of these patients are back to work within a few days, very little discomfort, and the technology that we have now, very few sutures involved, the mesh technology is relatively painless, and patients enjoy getting back to their normal activities very, very rapidly. The advances in the understanding of hernia technology, recurrences of hernias, has been very rapid in the last 10 to 15 years. And at the Hernia Institute of Louisiana, we've made it our business to ensure that we bring state-of-the-art approach to hernia problems for patients with new hernias, recurrent hernias, abdominal reconstructive problems, what have you. Our facilities are among the best in the country. We have the latest materials, latest methodologies at all of our facilities. In particular, the St. Charles Surgical Hospital in the heart of uptown New Orleans, where we have offices where we see patients both from the local region as well as from out of town. We also see patients at the West Bank campus of West Jefferson Medical Center, where the Surgical Clinic of Louisiana offices are located. Patients can also select opportunities to have their surgery at the West Bank Surgery Center, which is on the west side of the city, as well as the West Jefferson Medical Center campus. Our commitment to excellence in hernia surgery and abdominal wall reconstruction has led us to develop a surgical education program. In this opportunity, surgeons from around the world visit New Orleans, come to the Hernia Institute of Louisiana, spend a day or two with us, have an opportunity to experience both live surgeries in observation form as well as video sessions, didactic sessions, learning the techniques that we have perfected here. And through my experience as a member of the Board of Governors of the American Hernia Society, it's become very clear that in other countries in Central America and South America, there are a lot of patients who are in underserved areas, have abdominal wall reconstructive needs that exceed the ability of their local physicians and hospitals. With an effort to correct that, we've founded the Treen Hernia Foundation, which is an effort to bring patients quality hernia surgery either to their location through mission trips or to bring the patients actually back to New Orleans to have their surgery in a setting where we can give them the technology and the techniques that they need through a mission foundation. Patients and individuals or corporate interests who have desire to assist us in this are always welcome. We're always looking for additional volunteers to go with us to Central America, South America, and what have you, to participate in this opportunity, to give back, to give something back to the patients who otherwise can't find an opportunity to get this quality surgery. Now that you've had a diagnosis of hernia, you're looking for an opportunity to have this operation done once the right way. That's what we're about. We want to make sure that your experience is as painless as possible, as comfortable as possible, seamless as possible, and that through our opportunities to serve you, you'll recognize that this is the world-class facility that we hope you will.